I graduated from dental school 22 years ago. I did my residency program, and so I've been an orthodontist for 19-20 years now. There's some pretty significant technological changes that have occurred that have allowed us to use different types of braces or different technologies that can create space significantly better than we had in the past with much less force and therefore much less pain. Back in the past, children or adults would complain about how much braces really hurt, and a lot of that had to do with the materials that we were using. In the past, we would use stainless steel in our wires, and stainless steel, those wires can generate a lot of force on the teeth. And nowadays we use, space age wires like nickel titanium. They are much, much gentler. Average treatment times in the past could be anywhere from 30-36 months. It wasn't unusual to see kids in treatment for 3 to 4 years. And now, for the vast majority of patients, I can say that we can usually treat our cases in 18 to 24 months, sometimes less, okay? Depends on the problem. Sometimes if it's not comprehensive treatment, say oftentimes with adult patients where they have something very specific they want us to correct, and we decided to do what we call limited treatment. You can do limited treatment in terms of alignment of teeth, 8 to 12 months. Kids are pretty robust. I find that and even adults, usually they take no more than a week to get used to it. It's just having something rubbing against their teeth. But as I mentioned before, braces are much smaller than they used to be previously, and there's a lot of technology that goes into the manufacturing of the braces, so they're rounded, the corners are rounded, and there's really not a lot of sharp edges to the braces themselves. The discomfort that people, and everyone's a little bit different, there's pressure on the teeth, and that's a result of actually the wire exerting a force on the braces themselves. But as I said, we really try to maintain a low force level. One, because it is biologically more sound to move teeth that way, but two, it's much more comfortable for the patient. One of the biggest factors and one of the most important things that all the patients have to deal with is the use of retainers. And probably everyone's heard of a retainer. There's lots of different types that we can use. We can use clear ones, we can use ones with wires and metal on them. However, retention is a significant component of our treatment. And so when you think about braces, it is not just the active part of treatment, which is where you actually are moving the teeth, but it's trying to hold the position of the teeth afterwards. And so in our office, retention, although it is not 24 hours a day, 7 days a week, it is long-term, and it is nighttime wear for many, many years sometimes, depending on what the original problem was.